There are many ways to prevent HIV, so we're going to talk about a few key methods. Take a moment to pause the video and brainstorm some possible methods of prevention, then press play and see if you thought of everything we mentioned.
In the context of injecting drug use, HIV can be prevented by using new equipment for each injection, and by not sharing any equipment, including filters, spoons, or tourniquets, with any other person.
In the context of sexual health, condom use is a key prevention method. Use a condom every time you have anal or vaginal sex, and use water-based lubricant with the condom. The condom provides a barrier which stops fluids passing from one partner to another, and water-based lube decreases the chance of the condom breaking.
Another method is to engage in low or no-risk sexual practices like kissing, oral sex, or fingering. We recommend that you check out the Australian Federation of AIDS organization's website for their list of low to no-risk sexual practices.
Sexual health testing is another key method for HIV prevention. Getting tested for HIV means you know your status and can make relevant decisions about safe sexual practices. People who know they are HIV positive can protect their health and reduce risk of transmitting HIV by going on treatment, and people who know they are HIV negative can make informed decisions that can prevent them from acquiring HIV, like going on PrEP.
PrEP, or pre-exposure prophylaxis, is the use of anti-HIV medication by HIV-negative people to decrease the risk of acquiring HIV. It involves taking one pill a day. PrEP is highly effective if used correctly and can decrease the risk of acquiring HIV by more than 90%. In Western Australia, PrEP can be acquired with a script from a prescribing GP or through the PrEP-It trial. More information is available in our HIV resource sheet, which is linked in the description below.
There's also PEP, or post-exposure prophylaxis, which is a 4-week course of anti-HIV medication which can prevent HIV transmission only if taken within 72 hours of possible exposure to HIV. PEP is highly effective, but it's important to take it as soon as possible after potential exposure for maximum effectiveness. PEP can be obtained from some sexual health clinics and hospital emergency departments.
Treatment as prevention, or TASP for short, is an extremely effective prevention method which involves the daily use of HIV treatment to decrease viral load and greatly reduce the risk of transmitting HIV. Viral load describes the amount of HIV in someone's blood. HIV treatments can decrease a HIV-positive person's viral load to the point where it is completely undetectable. Studies have found no evidence of HIV transmission between partners with different HIV statuses using treatment as prevention. And the Center for Disease Control has recently endorsed U equals U, meaning undetectable equals untransmittable. That is, someone with an undetectable viral load cannot transmit HIV. We've known this for a while, but it's fantastic to have the CDC acknowledge TASP.
In terms of treatment, the medications used to treat HIV are called antiretrovirals. These treatments are so effective that an HIV-positive person can live a life no different to an HIV-negative person. A person living with HIV can work with their doctor to determine which combination of antiretrovirals is best for them. A doctor can also discuss various lifestyle factors that can influence the effectiveness of a treatment. Factors to consider include interactions between HIV medications and other medications, potential side effects of these medications, and the importance of taking medication daily.